Hey guys, today we're going to talk about potassium. And I don't know if you knew this, but the prehistoric diet was very high in potassium. Currently, an average male consumes about 3,000 milligrams of potassium. Honestly, I think it's less than that, but these are the numbers that I got. Women, about a little more than 2,000 milligrams of potassium, okay, per day. The RDA for potassium is 4,700. Prehistorically, and there's limited data on this, but the data that I found ranges between 7,000 and 15,000 milligrams of potassium. That's a lot of potassium. Our bodies need a lot of potassium for many reasons. One is that each cell has a sodium-potassium pump, so it uses a lot of those minerals to create energy and move things around in the body. Prehistorically, potassium was consumed through greens, tubers, and roots. I'm going to recommend stick with the greens and not do any type of potatoes. But the body is very flexible with potassium. If it has too much, it gets rid of it. If it doesn't have enough, it does retain it. And also, when you're doing intermittent fasting, you will conserve potassium and you won't need as much, okay, FYI. But the body does hold sodium. So what's even a little bit more important than the quantity of these minerals is the ratio of the minerals. You need 4 times as much potassium to sodium. An average person in America has a 1-to-4 ratio. Very light on the potassium, very heavy on the sodium. Not even from the foods, but from the refined carbs that deplete potassium and then hold sodium. So when you do a high carb diet, you're holding a lot of sodium and you're losing a lot of potassium. So you have this severe imbalance. So when you're potassium deficient or you're on a potassium deficient diet, meaning that you're not consuming enough vegetables, you tend to get high blood pressure and a high pulse rate eventually. Kidney stones, insulin resistance. One way to improve insulin resistance is to increase your potassium. When you have insulin resistance, you can't absorb potassium, but taking more can improve insulin resistance. But not having enough can throw off your blood sugars big time. Not having enough potassium can increase your risk of stroke. One big symptom is fatigue and low endurance. You go to the gym, you just don't have that vitality. Can't last that long. Also, it increases your risk for cardiac hypertrophy. What does that mean? It means that the heart actually enlarges. When you take potassium, it actually can go to the normal size that it needs. The problem, though, when you go to your doctor and get your potassium assessed, is they're looking in the blood outside the cell. Well, only 2% of your potassium reserves are outside the cell. 98% are inside the cell. That's why they're going to miss it. You have to do a special test, which is intracellular potassium. And the way people are deficient in potassium is they're not consuming enough of the right foods. Okay, so I'm going to show you in my book, this book, okay? On page 122, I listed a lot of vegetables, okay? So what you're going to notice when you read this is that most of the foods on this list are so high in potassium and so low in sodium. It's not even the 4-to-1 ratio. It's probably like 12-to-1, okay? But we do need some sea salt for sure, especially when you're doing intermittent fasting and healthy ketosis. But the point I'm trying to bring up is that when you do ketosis, make sure you do it healthily and make sure you do foods that are high in potassium. It just so happens those foods are also high in magnesium, the 2 top minerals that most people are deficient in. Now, high sugar diets will deplete potassium, refined carbohydrates will deplete potassium, and stress will do it too. So this is why if you go through surgery, for example, they may give you some potassium in an IV beforehand or during, because the high levels of stress that occur under surgery can deplete your potassium levels. Interesting. So anything with stress, injury, shock, surgery, you need more potassium. And if you don't have enough in your reserve, you can have all sorts of problems. All right, guys, thanks for watching. So if you want more knowledge on how to create a healthy body, subscribe now and get daily notifications. Daily notifications, that sounds weird. Well, I'll just remind you on a daily basis. How about that?